Hello, my name is Dr. Mark Capehart. I'm a fellowship-trained orthopedic surgeon at Eastern Oklahoma Orthopedic Center, and I specialize in pediatric orthopedics and treating adult spinal disorders. In this video, I will be discussing common treatment options for lumbar and cervical spine conditions. The lumbar spine refers to the lower back, where the spine curves inward toward the abdomen. It starts about 5 or 6 inches below the shoulder blades, connecting with the thoracic spine at the top and extending downward. The lumbar spine consists of 5 lumbar bones called vertebral bodies and 1 sacral bone. The cervical spine, also known as your neck, is delicate and houses the spinal cord. Your spinal cord sends messages from the brain to control all aspects of the body. It is also remarkably flexible, allowing movement in all directions. The cervical spine consists of 7 bones called vertebral bodies. Both the lumbar and cervical spine contain discs which act as shock absorbers. The disc is similar to a jelly donut in that it has a harder outer layer and a softer jelly center. The spinal cord and nerves lie directly behind this bone-disc complex. After you've been diagnosed with a lumbar spine condition, we will first work to resolve your pain using non-surgical treatment methods. These methods may include physical therapy, lumbar traction, anti-inflammatory medications, steroid injections, acupuncture, and chiropractic manipulation. These non-surgical treatment methods focus on restoring function and relieving pain. Although non-surgical methods cannot improve narrowing of the spinal canal, many people report that these treatments are successful in relieving their symptoms. Similarly, if you have been diagnosed with a cervical spine condition, non-surgical treatment methods, including soft collars, exercise, non-steroidal anti-inflammatory medications, epidural steroid injections, and chiropractic manipulation can be successful in relieving your pain. Surgery may be necessary for patients whose conditions do not improve with non-surgical treatment. Your surgical treatment will depend on your specific condition. The most common procedures used to correct conditions affecting the lumbar spine are laminectomy, spinal fusion, and minimally invasive decompression. The most common procedures used to correct conditions affecting the cervical spine are anterior cervical discectomy and fusion, anterior cervical corpectomy and fusion, foraminotomy, and laminoplasty. Prior to your spinal surgery, you may be asked to stop taking certain medications. You will be asked to stop smoking and have a general medical checkup by your primary physician. You may need to arrange for a family member or friend to stay with you for a few days after you return home, and you should not drive a car until you've been cleared to do so by your surgeon. After surgery, it is typical to spend 1 or 2 days in the hospital. This depends on how your body responds to the surgery. Most patients are able to resume a normal lifestyle 6 months to 1 year after surgery. Keep in mind the amount of time it takes to return to normal activities is different for every patient. Recovery time is often faster for patients who are young and in good physical condition. Maintaining a healthy attitude, keeping a well-balanced diet, and getting plenty of rest can also shorten your recovery time. In order to ensure optimal recovery, we recommend that patients walk as much as they can, multiple times a day. Wearing a brace is also critical. Your brace will provide the stability you need to heal properly. Physical therapy is also beneficial in the recovery from surgery, as well as in preventing future injury. To learn more about spinal treatment options, please visit our website at eooc.com. Thank you.